So, welcome back, and we apologize for being a bit late, as we had some informal consultations on the decisions and resolutions during the coffee break. So now we moving back, going back to our agenda, and the next agenda item is a roadmap on antimicrobial resistance for the WHO European region. So for this item, the relevant documents are displayed on the screen. And also, the WHO European region had a head start since the adoption of the EU and the WHO Europe Action Plans in 2011. Global momentum to tackle AMR took off with the adoption of the Global Action Plan on AMR in 2015. The European region once again has the opportunity to lead the way through a new European AMR roadmap to be considered in this session together with the draft decision. I would now like to invite Mr. Rob Butler, Director, Communicable Diseases, Environment and Health, to introduce this topic and share with us the vision of the roadmap's implementation. Mr. Butler, you have the floor.
Thank you very much, Chair, and thank you for allowing me to introduce the AMR roadmap to the delegates this morning. Good morning again to everyone. Antimicrobial resistance threatens our ability to alleviate suffering, and it threatens the foundations of our ability to treat disease. 130,000 deaths in our region are attributable every year to bacterial AMR. This is a health burden with an equivalent of HIV, TB, and influenza combined. In the European Union alone, the costs to healthcare and the associated costs in loss of productivity amount to 1.5 billion euros. A recent report by the European Observatory, and I wanted to thank Josep Figueras and the team, I believe they've left now, but thanks to the entire team, on a recent report that was published with Sweden and Taxmuke to Sweden and to our Swedish AMR ambassador, Dr. Malin Grapper. Very grateful that you're here with us, Malin, today. Thanks to that report, it was very clear and it really highlighted the fact that in the last 20 years, we've only seen a handful of new antibiotics developed and very few with any innovative characteristics, leaving them vulnerable, of course, to cross-resistance with existing drugs. The good news is that most member states now, 48 of you, have a national action plan on AMR. The bad news is that only 11 of those are financed. Of course, this situation was exacerbated during the pandemic as finances were funneled from AMR programs into pandemic response. Paradoxically, the pandemic has really shown us or given us a preview of what a post-antimicrobial era would look like, in the sense that it was a shared experience, an incredible burden, and a disease presented to us without a cure. It really should have provided us with a very strong wake-up call. Now, we've often heard of AMR referred to as the silent pandemic, but it's only silent for as long as we allow it to be silent. We need to be making more noise. It's not so much knocking at the garden gate as it is hammering on the front door of our houses now. It is an urgent crisis, and there is absolutely no time to wait. It seems in some senses that AMR is everybody's business, but it's nobody's responsibility. So I'd like to introduce you to somebody who believes that it should be everybody's responsibility. This is Maria, and Maria, I don't know where the cameras are, but a warm welcome to you. I know you're joining us on the stream. It's very early in Portugal at this moment, but I know you're following this session intently. Maria is a mother of two, an infection prevention control nurse, and sepsis survivor. After routine abdominal surgery, she was discharged, but only to return 24 hours later as she developed severe post-operative infection. That resulted in 64 days of hospitalization in an intensive care unit, and she barely survived. A healthcare professional whose life has been changed by AMR, Maria has now become a staunch advocate for the proper use of antibiotics and implementing antimicrobial stewardship and IPC programs. And again, thank you for joining us, Maria, today. And thank you for allowing me to tell your story. Her story and many of the stories that are displayed outside in the exhibition that some of you may have seen, and I would really invite you to read some of those stories from across the region. They ask us some very important questions, I think, that warrant our reflection today. Maria asked us, shouldn't all patients be safe in hospitals? She asked, shouldn't our ability to treat infection be improving and not deteriorating? And she also asks of us, given there is so much commitment and verbal commitment, particularly to AMR programs and in tackling AMR, shouldn't we also be seeing this translated into funding and action? And as I say, I think all three of those questions are really important for us to reflect upon today. We've been working around the clock at WHO on the objectives and targets of the European Strategic Action Plan on AMR, and I'm very, very privileged to have Dr. Miljana Grbić, our WHO representative to the Republic of Moldova, who is now going to say a few words about how WHO delivers in this space in the countries. Thank you, Miljana.
Thank you, Rob, very much, and thank you for inviting me to share and to tell about my story, my AMR journey as WHO representative in different countries. Distinguished delegates, I started in WHO country office in Serbia, and there I started to learn about how to address AMR as an individual and professional, and also how to engage communities. And my career, I started as a doctor, and it was very common to have safeguarding measures at our hospital. And for me, it was natural to prescribe antibiotics only after the diagnosis was confirmed and only after a proper antibiotic was identified. But when I joined WHO, I realized that one thing is to treat patients, and a very different one is to mobilize a community to help them understand why it is important to proper use antibiotics. And for that, what we need is clear communication from professionals, from media, and this is where I find WHO's role irreplaceable. So one of my first tasks was to support Ministry of Health to develop national AMR program. And this came amidst crisis. It was Ebola outbreak in Africa, and there was a lot of anxiety, a lot of concerns about Ebola spreading to Europe. But I found this moment very important to actually talk about AMR, to talk what antibiotics can protect us from and what not. And then I continued my journey in Romania, including my AMR journey. We worked with Ministry of Health, National Public Health Institute on the program, on the national AMR program. I can say that these were exciting times in Romania, as Romania had the presidency of the Council of European Union. And AMR was high on the presidency agenda, so was the work with WHO. But it was not long before another crisis, another outbreak hit, and this time it was COVID-19. So while we were tackling this pandemic, COVID-19, we had to tackle another, sorry to say, Rob, silent pandemic, AMR. To provide actually guidance to our member states on what and how antibiotics work in treatment of the disease. So I never stayed long enough in any of these countries to see actual adoption of the programs. And this is why I'm especially happy to witness one now in the Republic of Moldova. And I want to congratulate Ministry of Health and health partners on this milestone, and really to applaud their hard work as this comes again amidst another crisis, the refugee response crisis. And it is important also to say that prudent use of antibiotics at such times also is critical, and the national program actually is particularly important as it provides further guidance. And I always played team sports, as you can see here on the screen, this football match that I played here, and I can compare it because, as in sport, AMR is all about teamwork. So there is no one sector, there is no one action or one policy that can control AMR. Only by working as a team, we can succeed. Thank you for the invitation.
Thanks very much, Miliana. So, Chair, distinguished delegates, to thank you all very much for taking part in what was a very intensive round of consultations with the member states, the NSAs, within our own house also, and including our GDOs, our geographically dispersed offices. I'm very grateful to them particularly, and to all of you. This roadmap really enables us to do two things, and we're looking at the compass here. It enables us to gauge the strengths and weaknesses of our respective programs, but it also presents you with a range of interventions, about 53 interventions. Many of them innovative, all of them cost-effective and proven interventions for you to apply within the context of your national programs. So this is what this roadmap represents and what we hope it will do. It is, in that sense, a menu, not a recipe for success. So with that, Chair, we really very much look forward to the discussion. It will be a windy road, but we're hoping if we can raise the ambition, if we can make more noise, and of course, if we can together navigate that road, we'll get there in the region. So I'm going to pass the floor back to you, and we're very much looking forward to the discussion, as I'm sure Maria is, who is, as I said, joining us. Thank you.
Thank you very much, Mr. Butler, Dr. Milana Gibrich, for your valuable information and updating us on the AMR roadmap. And it is having country representatives of the WHO. It's a very crucial to have a country representative to this topic, which is affecting all of us. And now I would like to open the floor for the discussion. So if you would like to add any comments or remarks, please raise your name tag. So the discussion is open. So first I will give the floor to Spain, please.
Thank you. Honorable Chair, distinguished delegates, Spain delivers this statement on behalf of the EU and its member states. The EU and the member states want to thank the Secretariat for the roadmap and reiterate our continuous commitment to prevent antimicrobial resistances. Even though significant progress has been made during the last years in improving policies and strategies addressing antimicrobial resistances remain a serious global health threat. Strong action within a One Health approach is still needed. In the EU alone, more than 35,000 people die from antimicrobial resistance infections every year. In the world, there were an estimate of 1.3 million deaths attributable to antimicrobial resistances in 2019. Nowadays, the health impact of antimicrobial resistances is comparable to that of influenza, tuberculosis, and HIV/AIDS combined. The EU and its member states welcome and support the adoption of the roadmap on antimicrobial resistances for the WHO European region 2023-2030. The roadmap on antimicrobial resistances is a practical tool to guide member countries on the stepwise implementation of national action plans, helping them to identify and prioritize interventions adapted to the local and national situation. We especially welcome the inclusion of new relevant aspects, such as environmental and social determinants and community awareness and enabling behaviors. These are important areas that have been overlooked until now, but that are crucial to tackle antimicrobial resistances. Along these lines, prudent use of antimicrobials and high standards of infection prevention and control at the levels of the community, hospitals, and long-term care facilities are essential to reducing emergence and development of antimicrobial resistances. Promoting the use of vaccination also helps to prevent certain disease and avoid unnecessary use of antimicrobials. We are pleased with the inclusion of targets to measure progress. Setting measurable targets, especially reduction targets for antimicrobial consumption, are effective tools to foster prevention and to achieve national and global objectives. To implement the roadmap, we are happy to share the experience of EU member states to set reduction targets to combat antimicrobial resistance with a one-health approach to exchange best practice with member states who apply such targets. Still, targets should only be seen as milestones on the road towards antimicrobial resistance reduction, not as an end goal. Many countries have already achieved the proposed target of at least 60% of total antibiotic consumption belonging to the access group of antibiotics. These are antibiotics with a narrower spectrum of activity and a lower potential for AMR. A next more ambitious target could be considered to further encourage prudent use of antibiotics in all countries. We all need to have high ambitions and make as much progress as possible we can. We therefore welcome the recommendations already provided in the report, but we wonder if the Secretariat could develop stronger tools for evidence-based and cost-effective policy measures to reduce consumption of antimicrobials. Given the importance of this issue, this roadmap should not be another underused document. We encourage WHO Europe to continue this important work and to help countries in the European region with the next step, the practical operationalization of the roadmap. Technical and financial support will be needed for the operationalization. At global level, there are some instruments in place that provide financial and technical support to low and middle-income countries. For example, the Multi-Partner Trust Fund on AMR. But this support will not be enough. Cooperation between countries and support by WHO regional and country offices in the Euro region is crucial. Finally, we would like to see WHO Euro working together with WHO headquarters to promote this document in the other WHO regions, and in collaboration with the quadripartite organizations to expand it to the other sectors to ensure the One Health approach. Thank you very much.
Thank you very much, Spain. Next, I'll give the floor to Malta, following by Italy. Please.
Thank you, Chair. Malta aligns with the statement delivered by Spain on behalf of the EU and its member states. We are pleased that our region recognizes the AMR pandemic as a major priority, including by ensuring that AMR is prominent on our own national agendas. A transformation in human and animal health, as well as in food, plant, and environmental ecosystems is necessary. This means we need a much stronger focus on infection prevention and control across sectors, and that we must do everything we can to ensure that antimicrobials are used responsibly and sustainably. We are pleased that, by adopting a systems view and a One Health approach, the roadmap also supports these goals. It is our shared responsibility to work together across sectors. We also commend the roadmap's focus on strengthening governance of the AMR response, innovation, equity, and using data for action. We have now begun the process towards the UN General Assembly high-level meeting on AMR in 2024, for which Malta, together with Barbados, is a co-facilitator. It is vital that the high-level meeting is a game changer for the AMR response, with a political declaration that contains bold and concrete commitments, financing for implementation of national action plans, as well as evidence and outcomes-oriented targets for action that are needed to drive change and measure progress across sectors. The targets set by the EU earlier this year were a major step towards this progress. The issue of financing is especially important if low and middle-income countries are to effectively implement national AMR plans, action plans. Later this year, the GLG, the Global Leaders Group, and the quadripartite, co-chaired by Malta Deputy Prime Minister and Minister for Health, will release new estimates of the costs and return on investment of an effective AMR response, which will be key to guiding future advocacy and action, together with recommendations regarding the AMR pipeline, the antimicrobial pipeline, and access crisis, which is currently a major bottleneck in the response. Malta supports the adoption of the roadmap on AMR for the European region 2023 to 2030. Let us all work diligently and with a sense of urgency to implement this roadmap as an act of regional and global solidarity so that we minimize the further spread of resistance and preserve our precious antimicrobial agents for generations to come. Thank you.
Thank you very much, Malta. Now, Italy, following by Kazakhstan.
Chair, thank you for giving me the floor. Italy aligns itself with the statement delivered on this subject by Spain on behalf of the EU and its member states. We thank the WHO Regional Office for Europe for tabling the new roadmap on antimicrobial resistance, which we strongly support for endorsement by the Regional Committee. We believe that the implementation of this roadmap can be supported by the definition of targeted recommendations and measurable indicators. Member states progress differently to tackle AMR. Therefore, guidelines should address crucial gaps according to their implementation level. The EU Joint Action on Antimicrobial Resistance and Healthcare-Associated Infections is an example of this approach. Member states should support one another by sharing good practices and high-impact interventions, but also cooperating toward the mid- and long-term goals. International organizations have a key role to play in this area. The implementation of the roadmap on AMR for the WHO European region 2023-2030 will find strong foundations in our national action plan to tackle antibiotic resistance 2002-2025. The Italian plan has been built upon a multidisciplinary approach based on a One Health vision and on the lessons learned from the previous years. It aims at providing strategic and operational indications to address this looming emergency. Finally, as we stated in the general discussion, Italy will assume the presidency of the G7 in 2024. Over the year, we are looking forward to fostering multilateral collaboration and synergism to effectively address AMR. I thank you.
Thank you very much, Italy. Now, I give the floor to Kazakhstan, following by Slovenia, please.
Большое спасибо, господин председатель, уважаемый региональный директор, уважаемые участники. В 2019 году ВОЗ объявил АМР одной из 10 главных проблемных угроз общественного здравоохранения. Пандемия COVID-19 показала увеличение потребления антибиотиков во всем мире и создала реальную угрозу еще больше роста резистентности бактерий к антибиотикам уже в ближайшем будущем. В этой связи перед страной стоит задача по интеграции с мировым сообществом в вопросах сдерживания роста резистентности микроорганизмов к противомикробным препаратам, и данный вопрос подразумевает командную работу всех заинтересованных министерств и ведомств. Казахстан присоединился к инициативе ВОЗ по АМР в 2015 году и реализовал дорожную карту с 18 по 22 годы. С целью оценки и реализации рекомендуемых мер по сдерживанию устойчивости к микробным препаратам в Казахстане проведена техническая миссия Европейского регионального бюро ВОЗ в 2021 году, где отмечены достигнутые успехи в реализации дорожной карты в стране. Меры по сдерживанию к противомикробным препаратам продолжаются в рамках дорожной карты, принятой до 2027 года, и являются логичным продолжением мероприятий, реализованных до 2022 года. Хочу отметить, что дорожная карта разработана с учетом концепции «Единое здоровье». Пользуясь случаем, хочу поблагодарить наших международных партнеров в лице ВОЗ, CDC и других международных организаций, которые оказали содействие в разработке дорожной карты. В стране создана межведомственная координационная группа по реализации дорожной карты, включающая эпидемиологов, микробиологов, клинических фармакологов, инфекционистов и представителей ветеринарного сектора. На сегодня в республике функционирует Национальный координирующий центр по АМР и референс-лаборатории в области здравоохранения и ветеринарии. От имени Министерства здравоохранения Республики Казахстан разрешите поблагодарить Бюро и страну офис ВОЗ, особенно Скендер Сыва, за постоянное сотрудничество в поддержке по реализации инициативы по сдерживанию противомикробных резистентностей. В цели дальнейшего совершенствования и укрепления эпидемиологического надзора за АМР нужно содействие в проведении следующих мероприятий в рамках сотрудничества с ВОЗом. Это подготовка национальных и субнациональных тренеров по вопросам АМР, проведение научно-практических исследований, совершенствование и внедрение методических рекомендаций, создание геоинформационной системы, подготовка и реализация коммуникационной стратегии по повышению осведомленности населения. Успех реализации мер по сдерживанию растущей резистентности микроорганизмов к противомикробным препаратам невозможно без международной интеграции. Страны сильно различаются по своим социальным, политическим и экономическим условиям, системы здравоохранения и проблемы, с которыми они сталкиваются. В каждой стране имеются свои индикаторы достижения успеха, которые объединяют единой целью рекомендуемую Всемирной организацией здравоохранения. В рамках международного сотрудничества важным элементом является обмен опытом и лучшими практиками по реализации мероприятий по противомикробной резистенции. Казахстан поддерживает принятие дорожной карты. Благодарю за внимание.
Thank you very much, Kazakhstan. Now I give the floor to Slovakia, following by Ireland. Please, you have the floor.
Thank you, Chair. Slovenia aligns itself with the statement made by Spain on behalf of the EU. I'm honored to deliver this statement as the youth delegate of Slovenia, where we, young people, are very concerned about the issue of AMR. We would like to thank the regional director for the report and for the proposed roadmap, which we fully support. Slovenia believes that it is very important to gather information from the countries, monitor progress, as this will encourage all of us to do better. At the same time, we appreciate that the additional reporting burden will be minimal, as existing mechanisms will be used. There is a strong component of involving a wide range of stakeholders in the implementation of the roadmap, including communities and NGOs. Slovenia fully supports this approach, as we deem that one of the key aspects that need to be addressed to further prevent AMR is raising health literacy. Working with civil society is crucial in translating policies and research into language and actions of people in communities, be them professional or lay. And that is the key to success. We also emphasize that this is a cross-sectoral issue and fully support the One Health approach, working together with the environmental and animal health sectors to tackle the challenge of AMR. When it comes to implementation of such roadmaps, the main question to address is always the how, which is where we will require most of the support from WHO. We fully support the planned actions ranging from sharing best practices from countries and regular exchanges within expert networks to trainings and multi-stakeholder partnership fora organized by the regional office. As always, Slovenia is grateful to the regional office and the fellow member states for their support and commits to doing its part in the success of the roadmap. Thank you.
Thank you very much, Slovenia. Next, I'll invite Ireland, following by Kyrgyzstan.
Thank you, Chair, and can I say also thank you to our Kazakh colleagues for a wonderful event and a beautiful performance last night. And I'd like to mention also that my colleagues on the Irish delegation won the AMR quiz yesterday with a perfect 100% score. Ireland aligns itself with the statement delivered by Spain on behalf of the EU and its member states. Ireland welcomes the WHO's development of the roadmap on AMR for the WHO European Region 2023-2030 and is fully committed to the roadmap and its One Health approach to tackle AMR. Ireland encourages the WHO to continue to support member states to implement the roadmap through engagement at national and international level and by offering advice and guidance. A focus on people and patients was fundamental to the development of Ireland's second One Health National Action Plan on AMR for 2021 to 2025, otherwise known as INAP2. INAP2 sets out the 5-year roadmap for tackling AMR and enhancing infection prevention and control in Ireland. Like the WHO's roadmap on AMR, INAP2 includes a range of interventions and activities across the human health, animal health and environmental sectors, grouped under 5 strategic objectives. Each of the strategic objectives align with the actions contained in the WHO's diagnostic tool, the AMR Compass, and are based on a mix of best available evidence and expert opinion. In May of this year, 2023, Ireland published the INAP2 Human Health Midterm Review. This review was undertaken to ensure that ongoing learnings from the COVID-19 pandemic were captured to inform the remainder of the life cycle of the plan. The review was an opportunity for Ireland to pause and to reflect on the implementation of INAP2 and allowed us to assess and refine our approach. Also in May 2023, the National Clinical Effectiveness Committee launched a national clinical guideline on infection protection, prevention and control, and this was a significant milestone in patient safety. The guideline adheres to one of the major actions set out in the AMR Compass, namely the reduction in the burden and impact of infection through the control and prevention of infections. Ireland encourages other EU member states to provide support to each other in the implementation of the roadmap through the sharing of information and by engaging in a joint approach to tackling AMR. We look forward to continuing to work with the WHO and the member states on the roadmap in the coming years in order to develop high-impact interventions to tackle AMR. Thank you.
Thank you very much, Ireland. Now, I give the floor to Kyrgyzstan, following by Slovakia.
Уважаемый председатель, уважаемый региональный директор, уважаемые коллеги, от имени Министерства здравоохранения Кыргызской Республики позвольте поблагодарить организаторов за организацию данного актуального диалога для всех стран. Широкое применение, а подчас и нецелевой прием антибиотиков и противовирусных препаратов во время пандемии оказал свое влияние на ситуацию. Всем нам теперь придется говорить и об устойчивости не только к противомикробным препаратам, но и, возможно, к противовирусным препаратам. Сегодня мировое сообщество, следуя подходу «Единое здоровье», объединяет усилия, направленные на противодействие распространению антибиотикорезистентности. В Кыргызской Республике в целях его контроля применяется целый комплекс мер, направленных на защиту населения. С 2022 года реализуется утвержденная стратегия предупреждения распространения антимикробной резистентности до 2024 года. Ее выполнение осуществляется совместными усилиями представителей сектора здравоохранения, ветеринарии и сельского хозяйства. В рамках реализации межсекторальной стратегии проводятся информационные кампании для граждан, образовательные программы для специалистов по вопросам применения антибиотиков. Внедрена система мониторинга движения лекарственных препаратов в масштабах страны. Вместе с тем, нам многое предстоит сделать. Это изучение механизма возникновения антимикробной резистентности в ряде направлений, таких как окружающая среда, продовольственное сырье и производство продуктов питания. Также необходимо внедрение инструмента цифровой поддержки для анализа и визуализации данных с последующим принятием решения. Учитывая эти факторы, антимикробная резистентность включена в число 7 приоритетных направлений страновой стратегии сотрудничества между Всемирной организацией здравоохранения и будет запущена в ноябре текущего года во время визита регионального директора. И нам очень повезло, что в Кыргызстане проводится первое исследование распространенности антимикробной резистентности такого рода, и, очевидно, мы будем являться лидером в регионе. Мы понимаем, что границы в современном мире стерты. Если один находится под угрозой, то все в опасности. Именно поэтому Кыргызская республика поддерживает принятие дорожной карты по антимикробной резистентности для Европейского региона ВОЗ до 30 года, которая полностью отражает приоритеты страны по борьбе с антимикробной резистентностью. И страна рассчитывает на дальнейшее сотрудничество и поддержку Всемирной организации в этом направлении. Благодарю за внимание.
Thank you very much, Kyrgyzstan. Dear member states, as we have more than 30 countries who would like to take the floor, I would ask the delegates be constructive and concise as much as possible. Thank you for your understanding. So now I will give the floor to Slovakia, following by Iceland.
Thank you, Chair. I would like to be very concise. Slovakia aligns itself with the statement of Spain made on behalf of the EU and its member states on this agenda item, and Slovakia welcomes the work of the team of WHO Regional Office for the European region on AMR roadmap, which guides also our national AMR activities and supports prioritization and implementation of evidence-based intervention, including an ongoing process of the addition of evidence-informed guidelines and standards against AMR relevant to Slovakia national context and priorities. With the new government, which has been established only yesterday, we are expecting to approve the new action plan for the AMR based on One Health approach. And as Dr. Rob Butler has mentioned, we strongly hope that it will go also with appropriate budget for the implementation. We have observed, based on our own experience, that the essential link in the chain is multi-stakeholder engagement and effective collaboration. Each of them is important, and each of them is essential change maker. We emphasize that the AMR roadmap is a very practical and adaptable approach with high impact and doable interventions related to the national levels. We believe that country offices can play an important role in the training and lessons learned sharing as a key practices and activities on the engagement, sensitization, and improvement compliance of the key players at the national level. However, we recognize the need for the vital networks among member states in the region under the umbrella of WHO Regional Office as the best approach to assure continuity, equity, and benchmarking of the indicators, including epidemiological trends, while improving on data collection across the region. Alongside, we would like to highlight that we need to work more on cultural change through adoption of the policies and legislations, preventing blaming, shaming, labeling culture, and incentives related to the performance of the lower nosocomial and AMR infection reporting to change this philosophy in the practice. For example, in my country, we have found through the academic research these trends as well. In addition, we would like to request WHO European region to continue to play a key role in supporting and sharing the resources, data, and knowledge between countries to assure and decrease the gaps in implementation of the One Health AMR approach. Thank you.
Thank you very much. Now I give the floor to Iceland, following by Latvia. Please.
Honorable Chair, Regional Director, delegates, Iceland welcomes and supports the proposed roadmap on IMR. Iceland reports relatively high antimicrobial use in humans compared to other Nordic countries, but maintains low animal use and resistance levels. Our current national strategy on IMR is from 2019. And to continue now combating AMR, Iceland initiated a joint working group under the auspices of the Ministry of Health, Ministry of Food, Agriculture and Fisheries, and the Ministry of Environment in December 2022. Their task is to implement the national strategy with the focus on the One Health approach. The working group will introduce their actions by the end of November, so next month. But we already know that this will include close to 80 different actions. We face the same challenges as most other states, including fostering understanding among politicians, healthcare professionals, and the public, sustaining commitment, managing multiple activities, ensuring financial support, and promoting new antibiotic production, all of which are paramount. We highly appreciate the draft decision and its request to develop a monitoring, evaluation, and accountability framework based on the AMR roadmap's targets for the 74th session of the Regional Committee in 2024. Evaluation is crucial to measure progress and guide our efforts effectively. Iceland emphasizes the need for robust indicators to be able to see if we are on the right path in our mission to combat AMR. We are fully committed to this cause and anticipate collaborative efforts in addressing this global health threat. Thank you very much.
Thank you very much, Iceland. Now I will give the floor to Latvia, following by Sweden.
Dear Regional Director, dear colleagues, Latvia aligns with the statement of the European Union. We sincerely welcome the adoption of the roadmap on antimicrobial resistance for the WHO region. In our view, the roadmap successfully identifies the key areas where we need to work to make the difference. Prevention and control, social and environmental determinants, access to medicines and effective stewardship, public awareness and behavioral change. Guided by these priority areas, Latvia has already adopted a national One Health plan on AMR for years 23-24. This document serves as a basis for implementing the WHO roadmap in our daily routines. I am truly glad to inform all of you that with the substantial support of the WHO Regional Office for Europe, an international cross-sectoral One Health conference on antimicrobial resistance will be held in Riga, Latvia on 7 December this year. The conference will provide an excellent opportunity to promote the WHO roadmap in Latvia and in the region, and to facilitate dialogue between all relevant stakeholders on the next steps to curb the spread of AMR. For those interested in the topic, I invite you to participate in the conference, which will be held in a hybrid format. Indeed, we have a good cooperation with the Regional Office on AMR issues. Latvia has implemented most of the WHO's recommendations rendered throughout the years. Furthermore, we are looking forward to the participation of the WHO experts in an AMR assessment mission to Latvia. With regard to collaboration on AMR issues with other countries, I note that Latvia has very good cooperation with Baltic and Nordic countries. Thanks to the initiative of our Swedish colleagues, a cooperation project between the Baltic and Nordic countries has been set up, enabling experts from both the human and animal health sectors to exchange their knowledge. Such projects enable neighboring countries to support each other in dealing more effectively with the AMR threat that possesses a clear cross-border character. Accordingly, we believe that we have yet another potentially very effective tool for the implementation of the WHO roadmap. Thank you for the attention.
Thank you very much, Latvia. Now I would like to give the floor to Sweden, following by Hungary. Please, Sweden.
Excellencies, distinguished delegates, ladies and gentlemen, Sweden aligns itself with the statement delivered by Spain on behalf of the EU. Sweden welcomes this roadmap as it takes a broader systems view, striving to integrate the work against AMR with, for example, health security, universal health coverage, environmental and social determinants, and primary health care. The global work to counteract antimicrobial resistance is a long-standing priority for Sweden. Given the nature of the problem, it is inevitable to work together across sectors, across countries. If not, we risk living in a world where untreatable infections will cause tremendous suffering to humans and animals, as well as having a severe economic impact on our societies. Sweden is proud to have taken an active part together with other member states in the work preceding this final version of the roadmap, for example, through the consultation which we organized together with WHO in Stockholm in March. This roadmap provides practical guidance to everyone in the region, regardless of the state of the country's implementation work. We all need to further intensify the work against antimicrobial resistance in the years to come. From a Swedish perspective, this roadmap will assist in progressing our work on public awareness and behavioral insights, as well as our multi-sectoral cooperation. We acknowledge the importance of WHO's continued technical support to countries in their implementation of national action plans. A way to further enhance collaboration between countries is through connections with WHO collaborating centers. The WHO Collaborating Center at the Public Health Agency of Sweden has experience from integrated work on AMR and can provide support in areas such as infection prevention and control, surveillance, antibiotic stewardship, and access to antibiotics. We warmly welcome more collaborations within the European region. One process that is in focus right now at the global level is the upcoming high-level meeting on AMR in the UN General Assembly in September 2024. Sweden believes that it is of utmost importance to work proactively for this meeting for the best possible result. We have a critical year ahead of us. We therefore look forward to, together with all of you, pushing for tangible outcomes and concrete yet bold commitment next year. Thank you for your attention.
Thank you very much, Sweden. Now I give the floor to Hungary, following by Lithuania. Please.
Thank you, Chair. Distinguished colleagues, Hungary welcomes the roadmap on AMR, a tool that, according to our expectations, will support member states to prioritize, implement, and monitor selected policy interventions to tackle this major global health challenge more efficiently. IPIS is a public health priority in Hungary and highlighted the country's national health strategy. The elements of the roadmap are fully in line with the complex concept of patient safety in Hungary and with our draft national AMR action plan. In this context, we confirm our commitment to improve antimicrobial stewardship in an evidence-based manner, driven by continued monitoring of the consumption of antimicrobials and antimicrobial resistance in the healthcare system. To this end, Hungary has cooperated with the regional office to produce the first of a series of policy evidence briefs on AMR in European region. In line with the core elements of the roadmap, Hungary wishes to strengthen infection control, water, sanitation and hygiene in healthcare institutions and beyond. Environmental monitoring of AMR is currently being developed in Hungary in compliance with the One Health approach. With the support of the regional office, we have started to explore attitudes towards antimicrobial usage in order to develop and implement behavioral changes initiatives amongst healthcare workers, veterinarians, animal keepers and citizens. Regarding the animal health sector, Hungary has introduced clear aims for reduction, such as strong monitoring of real-time consumption, introducing legal provisions on data collections and surveillance, reaching gradual and post-graduate education programs, and funding farmers for IT and diagnostic purposes. IPC and antimicrobial stewardship, training and education are key to ensure sustainable implementation and should be developed further both as bilateral cooperation and peer-to-peer learning. Harmonization of methods for monitoring the spread of resistance should be strengthened and data sharing should be facilitated. We strongly encourage further cooperation between the regional office, the EU and professional organizations to provide joint platforms to reduce the harmful health, economic and social effects of the global spreading of AMR. Hungary is grateful to continued professional guidance given by WHO in the exploration of the One Health aspects of AMR in Hungary and ready to further expand our cooperation. Thank you for your kind attention.
Thank you very much, Hungary. Now, Lithuania, following by Switzerland. Please take the floor.
Thank you, Chair. Lithuania aligns itself with a statement delivered by Spain on behalf of EU and its member states. Lithuania acknowledges the increasing importance of intensifying efforts to combat AMR and welcomes the adoption of the WHO roadmap in guiding these actions. We are confident that implementing the roadmap will greatly enhance our initiatives against AMR. To tackle AMR challenges in Lithuania, we have proactively established intersectorial AMR management groups in every county, uniting representatives from various sectors to address AMR-related concerns. We have also approved the action plan for the prevention and control of AMR and recommendations for rational use of antibiotics. Our further objectives encompass the creation, testing, and wider implementation of antimicrobial stewardship model in hospitals, as well as enhancing the capacities of the national laboratory in AMR testing. Additionally, we will hold a national workshop to introduce and discuss the implementation of the WHO roadmap with all the stakeholders. A lot of aspects of the WHO roadmap are already incorporated into our strategic documents, and we plan to integrate further elements when reviewing and updating our current action plan, utilizing the AMR Compass tool. Collaboration among sectors is vital for combating AMR. Therefore, we acknowledge the pivotal role of the WHO in further promoting One Health approach. We emphasize the importance of consulting with WHO as well as sharing best practices among countries whilst implementing this roadmap. I thank you.
Thank you, Lithuania. Now, Switzerland, following by Germany. Please take the floor.
Vielen Dank, Herr Exekutivpräsident. Sehr geehrter Regionaldirektor, sehr geehrter Exekutivpräsident des Regionalkomitees, sehr geehrte Delegierte. Für die Schweiz steht das Ziel, die Zunahme von Antibiotikaresistenzen einzudämmen, ganz oben auf der politischen Agenda. Im Jahr 2015 wurde eine ehrgeizige nationale Strategie nach dem One Health-Ansatz, genannt STAR, verabschiedet, die den globalen Aktionsplänen der WHO zur Antibiotikaresistenz, auch genannt AMR, Rechnung trägt. In diesem Sinne begrüßen wir den Fahrplan zur Bekämpfung der antimikrobiellen Resistenz für die europäische Region der WHO 2023 bis 2030, der eine klare Orientierung bietet und es den Mitgliedstaaten der WHO-Region Europa ermöglichen soll, die Arbeit bei der Bekämpfung von AMR zu beschleunigen. Die Schweiz begrüßt insbesondere den Kompass zur Bekämpfung von AMR und die Tatsache, dass dessen Aktionsbereiche auf einer Kombination der besten verfügbaren Forschungserkenntnisse beruhen und von den Ländern an ihren eigenen nationalen Kontext angepasst werden können. Die Schweiz ist zurzeit daran, ihre Strategie zur Bekämpfung von Antibiotikaresistenzen zu aktualisieren. In diesem Rahmen soll zwischen 2024 und 2027 ein nationaler STAR One Health Aktionsplan umgesetzt werden, wobei die Inhalte des WHO-Euro-Fahrplans bei dessen Entwicklung berücksichtigt werden sollen. Abschließend ermutigen wir das WHO-Regionalbüro für Europa, die Mitgliedstaaten weiter einzubinden, zum Beispiel durch die Organisation gezielter informeller Diskussionen über die im Fahrplan zitierten Maßnahmen, um die nationalen Bedarfe zu ermitteln. Besten Dank.
Thank you very much, Switzerland. Now I give the floor to Germany, following by Montenegro. Please, you have the floor.
Sehr geehrter Herr Vorsitzender, sehr geehrte Damen und Herren, Deutschland schließt sich dem Statement der EU vollumfänglich an. Antimikrobielle Mittel gehören zu einem der wichtigsten Arzneimitteln. Jedoch haben übermäßige Verwendung und zum Teil falsche Anwendung im Laufe der Jahre zu einer Zunahme von Resistenzen geführt. Dadurch werden Substanzen unwirksam, die Behandlung von Infektionen schwieriger oder gar unmöglich. AMR, wie wir schon gehört haben, auch als stille Pandemie bezeichnet, ist allein in der EU für mehr als 35.000 Todesfälle pro Jahr verantwortlich und verursacht somit nicht nur hohes Leid, sondern auch hohe Kosten für Gesundheitssysteme. Deutschland begrüßt daher ausdrücklich die Entwicklung der Roadmap zu AMR sowie den AMR-Kompass, der unseren Weg zukünftig vorgeben soll und anhand seiner Handlungsfelder klare Vorgaben beschreibt. Wir wissen, dass der Antibiotikaverbrauch und die Resistenzraten in der Humanmedizin in der WHO-Euro-Region sehr unterschiedlich und mitunter erschreckend hoch sind. Wir wissen aber auch, dass Antibiotikaresistenzen vor Grenzen nicht Halt machen. Hohe Resistenzen in einem Land sind auch das Problem der gesamten Region. Wir werden AMR nur reduzieren, wenn alle WHO-Euro-Mitgliedstaaten die AMR-Roadmap in ihren Strukturen implementieren. Nationale AMR-Aktionspläne müssen konsequent umgesetzt werden und wo noch nicht vorhanden, auch entwickelt werden. Lassen Sie mich diesen Rahmen auch noch einmal nutzen, um etwas zum internationalen Pandemieabkommen zu sagen. Aus unserer Sicht sind die Verhandlungen des Abkommens ein wichtiger Meilenstein auf globaler Ebene, besser auf zukünftige Pandemien vorbereitet zu sein und effektiver und gerechter agieren zu können. Auch hier ist aus deutscher Sicht AMR, und ich betone es noch einmal, als stille Pandemie, ein zu beachtendes Element. Denn es geht nicht nur um die Verhinderung viraler Pandemien, nein, es geht auch um die stille Pandemie, ausgelöst durch AMR. Ich möchte noch einmal dafür werben, AMR in das internationale Pandemieabkommen aufzunehmen. Und zuletzt, da AMR nicht nur ein Thema ist, das Menschen betrifft, müssen wir auch für Tiere und Umwelt entsprechend agieren. AMR muss im One Health-Kontext angegangen werden. Viele Kollegen haben es bereits angesprochen. Deshalb appelliere ich an Sie alle, sich auch bei den Verhandlungen zu internationalen Pandemieabkommen dafür stark zu machen. Vielen Dank.
Thank you very much, Germany. Now I give the floor to Montenegro, following by the United Kingdom. Please.
Dear Regional Director, dear colleagues, antimicrobial resistance, the silent pandemic, is one of the major threats undermining our ability to deliver on the universal health coverage promise and the sustainable development goals. Effective response to AMR is a moral imperative. AMR costs us lives and money. We cannot afford any longer to ignore the deadly threat that drug-resistant microorganisms pose to our health. During the pandemic, we realized, as Rob said, AMR is an unfinished and everybody business. Hence, an urgent action is required. Insisting on high-impact interventions to tackle AMR has no alternative. AMR is one health issue. It encompasses human health, animal health, plant health, and the environment as such cannot be tackled by one sector independently or by individual countries alone. Montenegro welcomes the proposal of the new roadmap to provide a sustainable solution on AMR epidemic. Through implementing the national program on AMR control, our AMR Compass, Montenegro reaffirms its commitment to address AMR through promoting One Health approach, strengthening governance, insisting on infection prevention control, improving access to medicine, and addressing environmental and social determinants. As the trajectory of the epidemic has been determined to a great extent by our behaviors, we will also focus on raising awareness and changing behaviors. Montenegro is one of the front runners with respect to the use of antimicrobials. The national programs seek to encourage the prudent use of antimicrobials, such as antibiotics in human and animal health, through a series of vulnerary measures, with the aim of reducing the risk that microorganisms will become resistant. One of the priority actions will be putting in place operational clinical decision support system as a prerequisite for an effective antimicrobial stewardship. Hence, continued WHO support in developing evidence-based guidelines for rational use of antibiotic and treatment of the most common bacterial infection acquired among the hospitalization patients will be invaluable. Additionally, in 2023, WHO support Montenegro embarked into the first ever national point prevalence survey, that will help us generate solid evidence to inform infection prevention, control, and antimicrobial stewardship intervention in the country. We believe that only through commitment to regional collaboration among the Western Balkan countries with WHO and EU support, sustainable solution on access to the needed narrow-spectrum antibiotics could be made. Once again, I would like to thank WHO for continued support in addressing AMR threat. Thank you.
Thank you very much, Montenegro. Now I give the floor to United Kingdom, following by France. Please, you have the floor.
Thank you, Chair. I will be brief, as many excellent points have already been raised. We welcome the publication of the roadmap. It is focused, it is actionable, and we thank the Regional Office for the open and collaborative approach to its development. We're particularly pleased that previous feedback on prioritisation has been taken into account, including on infection prevention and control, and we support the guiding aims of the roadmap and compass. The publication is timely for many of us, including in the United Kingdom, as we are currently developing our new antimicrobial resistant national action plan. Euro Office should now support Member States with the implementation of the roadmap by guiding us all on prioritising and setting targets for high-impact interventions, including on One Health. In the interests of brevity, I will pick out just 3 key actions, which are, number 1, the creation of robust monitoring and evaluation systems, 2, advocacy or continuing advocacy for high-level political commitment. And on targets, the Euro region should be ambitious on targets across the board, specifically on targets for total antibiotic consumption across the access, watch, and reserve categories. The AWARE index is crucial for effective stewardship, and we should all be aiming for a significant level of ambition on total antibiotic consumption in the access category. We must preserve those on the watch and reserve list for specific indications and as last resort options. Summarising, the time between now and 2030 will be critical, not just for the region, but for the world in the fight against AMR. We look forward to working with colleagues on delivering the roadmap. The region should seek to lead the charge on this global priority, particularly as we approach the landmark opportunity provided by the high-level meeting on AMR in 2024. Thank you, Chair.
Thank you very much, UK. Now I give the floor to France, following by Netherlands. Please, you have the floor.
Merci, Monsieur le Président. La France se félicite de la feuille de route proposée et s'associe pleinement à la déclaration de l'Union européenne prononcée par l'Espagne. Cette nouvelle feuille de route confortera nos travaux engagés à l'échelle nationale sur la lutte contre la résistance aux antimicrobiens sur plusieurs principes, à savoir une approche qui combine la prévention, le contrôle et la gestion de l'infection, une intégration de l'approche One Health sans perdre de vue les défis concrets en matière de santé humaine, le ciblage à la fois des professionnels et du grand public par des stratégies adaptées de sensibilisation et de communication, l'accent mis sur la surveillance, sur la recherche et le développement, et sur l'accès à un arsenal thérapeutique à la puissance préservée. Cette feuille de route est un levier puissant. Pour qu'elle soit pleinement efficace, l'OMS pourra contribuer à préciser certaines attentes et leviers derrière les actions proposées, notamment une clarification du champ couvert par des actions à court et à long terme, une coordination avec d'autres organisations compte tenu d'aspects dépassant le mandat de l'OMS Euro, notamment dans les domaines de la santé animale et de la production alimentaire, seront également bienvenus. Outre le renforcement des plans d'action nationaux, l'OMS pourrait également chercher à renforcer la collaboration internationale sur ces questions et à mobiliser les leviers existants, notamment par le biais de la quadripartite et du panel de haut niveau sur l'approche Une seule santé. Enfin, des échanges réguliers avec l'Union européenne seront précieux compte tenu de nombreuses initiatives financées par la Commission à ce niveau, en particulier l'action conjointe européenne UE-JAMRAI 2, démarrant en janvier 2024 et que la France coordonnera à nouveau à travers l'INSERM. Ces échanges permettront d'assurer que les outils fournis par la feuille de route seront bien connus et mobilisés par toutes les parties prenantes. Je vous remercie.
Thank you very much, France. Now, Netherlands, following by Austria.
Thank you, Chair. The Netherlands aligns itself with the statement delivered by Spain on behalf of the EU and its member states. We thank the Secretariat for the continuous commitment to address AMR and welcome the roadmap on AMR for the WHO European region. Fighting AMR is complex and needs strong collective action. the roadmap on antimicrobial resistance for the WHO European region is a valuable and inspiring tool for prioritizing activities, setting additional targets, and to support countries to implement national action plans. The Netherlands remains deeply committed to the fight against AMR, both at European and international level. At the international level, we demonstrated this commitment by organizing 2 One Health ministerial conferences to support WHO and quadripartite. An important outcome was the launch of the Multi-Partner Trust Fund. This fund has been specifically created to support lower and middle-income countries in designing and implementing their One Health national action plans. And the Netherlands underlines the importance of long-term, flexible, and balanced funding for AMR. And I'm therefore happy to share with you that the Netherlands recently increased its contribution to the Multi-Partner Trust Fund with a new donation of €4.5 million in total for the period 2023-2025. At the European level, the Netherlands has been financial and technically supporting the WHO and the European region through the activities of our National Public Health Institute as a WHO collaborating center for antimicrobial resistance, epidemiology and surveillance. This center will keep supporting WHO work towards strengthening AMR surveillance and the CSER network by supporting capacity building activities at the national level and by providing technical advice and technical support. I thank you.
Thank you very much, Netherlands. Now I give the floor to Austria, following by Finland. Please, you have the floor.
Vielen Dank, Herr Exekutivpräsident. Österreich schließt sich der Wortmeldung von Spanien im Namen der EU und ihrer Mitgliedstaaten an. Österreich begrüßt den neuen Fahrplan zur Bekämpfung antimikrobieller Resistenzen in der europäischen Region der WHO 2023 bis 2030 sowie den AMR-Kompass. Hinsichtlich der Bemühungen zur Bekämpfung und Prävention von AMR konnten bereits große Fortschritte erzielt werden. Dennoch ist noch viel Arbeit erforderlich, um unsere Maßnahmen im Sinne eines One Health-Ansatzes zu vereinheitlichen, zu straffen und zu verstärken. Wir gehen davon aus, dass dieser neue Fahrplan und der Kompass den nächsten Schritt in Richtung einer Reduktion von AMR und therapieassoziierten Infektionen sowie eines gerechten Zugangs zu wichtigen Behandlungen darstellt. Österreich begrüßt insbesondere den direkten und zielgerichteten Ansatz des AMR-Kompasses. Dieser ruft die Mitgliedstaaten dazu auf, den nationalen AMR-Stakeholdern die Möglichkeit zu geben, die Bedürfnisse ihres Landes zu bewerten, nationale Ziele und Messrahmen festzulegen sowie rechtsverbindliche Maßnahmen umzusetzen. Österreich ermutigt das WHO-Regionalbüro für Europa, die Bemühungen und Initiativen in den Bereichen AMR, Infection Prevention and Control und Healthcare Associated Infection Surveillance Network weiter zu bündeln. Dabei darf insbesondere auf die jüngste Empfehlung des Rates der EU zu AMR sowie auf den geplanten Aktionsplan für IPC aufmerksam gemacht werden. In mehreren Initiativen wurden Ziele und messbare Maßnahmen vorgeschlagen, was zu begrüßen ist. Diese Ziele müssen genauso anspruchsvoll wie auch erreichbar sein. Österreich freut sich darauf, den neuen Fahrplan zur Bekämpfung antimikrobieller Resistenzen auf nationaler Ebene umzusetzen. Wir hoffen, mit den anderen Mitgliedstaaten zusammenarbeiten zu können, um die Umsetzung in der gesamten europäischen Region sicherzustellen. Wir ermutigen das WHO-Regionalbüro für Europa, diesen Umsetzungsprozess durch fachliche, informationelle und organisatorische Unterstützung zu fördern. Vielen Dank.
Thank you very much, Austria. Now I give the floor to Finland, following by North Macedonia. Please, you have the floor, Finland.
Thank you, Chair. Finland aligns itself with the statement of the European Union and its member states delivered by Spain. Finland finds this roadmap a comprehensive document that covers all important areas of AMR, extensive multi-sectoral whole-of-society actions, in line with the One Health approach. And preventing selection of resistant microbes and preventing spread of them are the essence. Finland welcomes that infection prevention and control, IPC, is included in the roadmap as high-impact interventions. While the prudent use of antimicrobial decreases selection pressure for resistant microbes, IPC is important to control spread of them, especially in healthcare facilities. Finland especially welcomes that water, sanitation and hygiene are acknowledged in this roadmap at the community level. Now, Finland would like to see the role of vaccination emphasized when implementing this roadmap. Prevention of infections through vaccination reduces the need for and the use of antibiotics, and also the burden infections cause to the healthcare systems. AMR is a global cross-border health threat that requires continuous preparedness. This needs to be taken into account when negotiating other international instruments, such as the Accord on Pandemic Prevention, Preparedness and Response. Finland is in the process of updating our National Action Plan on Antimicrobial Resistance based on the guidelines of the WHO. Thank you very much.
Thank you very much, Finland. Now I give the floor to North Macedonia, following by Belgium.
Thank you, Chair. Distinguished delegates, I stand before you today to address the critical issue of antimicrobial resistance and our commitment to implementing the roadmap on antimicrobial resistance for the World Health Organization European Region 2023-2030 North Macedonia. North Macedonia has made great progress in this effort to migrate antimicrobial resistance. However, the One Health aspect of antimicrobial resistance, prevention and control need to be further developed. The antimicrobial resistance roadmap will provide guidance for this. In this line, we would like to also put a focus on the surveillance of antimicrobial resistance within the laboratory information management systems. We will prioritize educational initiatives aimed at healthcare professionals, patients, and the public to promote the responsible use of antibiotics. We are also going to work to strengthen infection prevention and control measures in healthcare facilities to reduce the spread of resistant infection, focusing on capacity building for healthcare workers. The World Health Organization's support is invaluable in our efforts to address antimicrobial resistance. We seek World Health Organization Europe's support in developing the skills and knowledge of our healthcare professionals at human and animal sector to ensure the responsible use of antibiotics and effective infection prevention and control. As we implement the roadmap, financial support and support for resource mobilization from other donors will be crucial. We firmly believe that countries can enhance their collective efforts to achieve this. We propose sub-regional meeting where countries in the Balkan region can share their best practices, experiences, and lessons learned in implementing the roadmap. In closing, North Macedonia is committed to implementing the roadmap on antimicrobial resistance for the WHO European Region 2023-2030. Thank you for your attention.
Thank you very much, North Macedonia. Now I give the floor to Belgium, following by Denmark, and after that we will go to the lunch break. And after the lunch break, we'll still have 6 more member states who would like to take the floor. So we'll start from Norway, and then we'll go to our international partners and non-state actors. So please, now Belgium, you have the floor.
Thank you, Mr. Chair. Belgium aligns itself with the statement delivered by Spain on behalf of the EU and its member states. We also thank the Regional Office for the development of the new roadmap on AMR for the European region. 2 years ago, Belgium adopted a fully funded national One Health Action Plan on AMR. This plan is well aligned with the new WHO roadmap. Dear colleagues, the so-called silent pandemic is not so silent anymore. ECDC data show that the number of infections and deaths due to antibacterial resistance increased significantly. But if AMR is indeed a major health crisis, why aren't we treating it as one? We note, for example, that the consumption of broad-spectrum antibiotics increased between 2012 and 2021, and there is abundant evidence of inappropriate and overuse of antibiotics. We welcome the heightened focus on evidence-based high-impact interventions and less on expert opinion in the new roadmap. However, we also highly encourage the Secretariat to develop more concrete, cost-effective policy measures to effectively reduce the overconsumption of antibiotics. Here, we should also dare to look into more constraining measures, such as more restrictions on the prescription of antibiotics by physicians, and also long-hanging fruit, such as the prohibition of over-the-counter use of antibiotics. In our view, the current repertoire of measures focuses too much on passive dissemination implementation strategies, such as information campaigns and guidelines. These are insufficient to achieve the ambitious targets our populations need. Furthermore, we need to accelerate research and development of new antibiotics and especially other medical technologies that prevent the development of resistance if we want to remain able to treat infectious diseases. The debate on the most cost-effective push and pull incentives to do this is still equivocal. New last resort antibiotics are indeed needed, but likely resistance will develop rapidly with unrestricted use and with current marketing practices of the pharmaceutical industry for new drugs. Finally, our country comments that the One Health principle is indeed underpinning our fight against AMR. Thank you, Mr. Chair.
Thank you very much, Belgium. Now I give the floor to Denmark. You have the floor.
Thank you, Chair. Denmark aligns itself with the statement made by Spain on behalf of the European Union and its member states. The growing AMR crisis is a major threat to public health, and immediate action is needed. Denmark therefore fully supports the roadmap that will provide helpful guidance to member states. In order to ensure the best possible implementation, we encourage WHO to support member states in prioritizing the most important actions first. We will not succeed in combating AMR without working across sectors. We look forward to the One Health operational framework to be adopted in 2024. And we appreciate the focus on gender as well as on preventive measures such as IPC and WASH. The roadmap also mentions the risks related to climate change. Climate disasters increase the risk of spreading resistant bacteria, disease outbreaks, and new infectious diseases. Linking climate and health is therefore essential. The proposed interventions require political commitment, and we must recognize that political awareness and action is necessary if we want to achieve the outcomes set out in the roadmap. We must also recognize that the context is different in every country. Identification, prioritization, and implementation of AMR interventions must be adapted to the national context in order to ensure sustainability. One of the key priorities for Denmark is to support low and middle income countries in developing sustainable solutions to AMR. ICAS, the International Center for AMR Solution, works through partnerships with low and middle income countries to co-develop sustainable and context-specific interventions on AMR. Denmark invites all countries to join us in partnering with ICAS. Accelerated action is needed on a global level, and we are very happy that the proposal to include AMR on the agenda for the next executive board was accepted. We look forward to engaging in the work on a resolution, as well as in the preparations for the upcoming UN high-level meeting on AMR next year. Thank you.
Thank you very much, Denmark. And before we go to the lunch break, I would like to give the floor to Gabriel Jacob for a few announcements. Please, Gabriel.
Thank you very much, Mr. Chair. The network of national counterparts will be holding an informal gathering during lunch. It will take place in the Caspian room, across from the plenary room. Anyone interested in learning more about the network is welcome, according to the colleagues who will be hosting the event, so please do pay a visit if that's of interest to you. We will resume at 1400 hours at 2 p.m., but if we could ask you please to be in the room 5 minutes early so that we start promptly on time. Thank you very much indeed, and bon appétit.
Okay, ladies and gentlemen, we'll resume our session. And the member states still returning back to the hall from the lunch. As we shortened the time for the lunch break, it's totally understandable. But shall us begin? And I would like to give the floor to Norway now, following by Croatia. So Norway, you have the floor, please.
Thank you, Chair, President, Regional Director, dear colleagues. We would like to thank the WHO for their important work on this roadmap and welcome its publication. Antimicrobial resistance is an ever-growing threat in all our countries. We commend WHO for its consultant-based approach. We hope that this roadmap will contribute significantly to help governments develop and implement effective and costed measures with a solid evidence base. This will help us all in the global fight against IMR. We also support the One Health foundation of the roadmap, even as it concentrates on measures in the human health sector. Norway has a long history of national strategies and action plans for fighting IMR. We are especially happy to see that the roadmap includes infectional prevention and control, surveillance, housing standards, behavioral science, fungal infections, and access to medicines. Our experience tells us that they are vital if we are to succeed. It will be important to consider this document in relation to other discussions at a global level, including the INB negotiation and the upcoming UN high-level meeting on IMR. There is much to be learned from bilateral and multilateral meetings between countries and regions. The roadmap should also be used to facilitate these kind of discussions. We need to ensure that the roadmap develops further to include more evidence-based approaches that will assist all countries regardless of where they are on their IMR journey. We hope that this roadmap can be seen as a starting point. Thank you.
Thank you very much, Norway. Now I give the floor to Croatia, following by Moldova, please.
Thank you, Chair. Dear Excellencies, dear colleagues, Croatia aligns with the statement of the European Union and its member states. Croatia welcomes the new WHO document on combating AMR as it provides a very useful and practical tool to implement changes. The implementation of the roadmap requires a complex and comprehensive response from the many national AMR stakeholders. Those AMR stakeholders are already well defined in Croatia, and there is a great deal of intersectoral collaboration going on already. But implementation of the roadmap will present a further challenge, focusing on achieving more visible outcomes. We plan to discuss the roadmap within the Croatian AMR intersectoral mechanism first, to set up the priorities, divide tasks, and make sure that all stakeholders are familiar with the roadmap and expected outcomes. WHO Europe could support implementation of the roadmap by mediating the exchange of good practices among countries and identifying good role models for specific action areas. Exchange of appropriate regulation and guidance documents between countries would also very much facilitate roadmap implementation. Thank you.
Thank you very much, Croatia. Now I would like to give the floor to Moldova, following by Romania. You have the floor, Moldova, please.
Thank you, Chair. Distinguished delegates, dear colleagues, Republic of Moldova is a part of the global antimicrobial resistance surveillance system and Central Asian and Eastern European antimicrobial resistance surveillance network. In this respect, my country has established MER surveillance to provide a comprehensive system for monitoring the prevalence and trends, which helps align Moldova's surveillance efforts with international standards and facilitates data sharing and benchmarking. The general objectives for addressing antimicrobial resistance at the national level are incorporated in the recently adopted national program for the surveillance and control of antimicrobial resistance for the next 5 years that include: first, strengthening national capacities, coordination mechanism, and policy development in the human, veterinary, and agricultural sector to accelerate intersectorial responses to combat AMR, as well as for the prevention and control of infection in medical and veterinary institutions by 2027, which includes harmonization of national legal framework and implementation of EU standards. Second, raising awareness of antimicrobial resistance among the population and healthcare and animal health professionals, integrating the field of antimicrobial resistance into professional development programs in the human and animal health, agricultural, and environmental sector. Third, strengthening mechanisms for the market authorization, prescription, and distribution of antimicrobial products across the sectors, aligning them with both national and international standards for the prevention and control of antimicrobial resistance. We are fully committed to implement the roadmap in the Republic of Moldova through mobilizing the necessary resources, expertise, and relevant stakeholders towards the fulfillment of all activities according to our national program for the years 23-27, aimed at combating antimicrobial resistance. The following measures will empower the healthcare system: national commitment, intersectoral collaboration and strong communication, surveillance and data exchange, strengthening laboratory capacities, and thank you very much to European Union and WHO that improve the situation with equipment in our laboratories, professional training, international expertise, health promotion, and medical research. The Republic of Moldova strongly supports the endorsement of the European Roadmap on Antimicrobial Resistance, which aims to support countries in the region to identify, prioritize, implement, and monitor high-impact interventions to tackle antimicrobial resistance and accelerate implementation efforts. Thank you.
Thank you very much, Moldova. Now I'd like to give the floor to Romania, following by Tajikistan.
Thank you, Chair, for the floor. Regional Director, distinguished delegates and colleagues, Romania aligns with the statement delivered by Spain on behalf of the European Union and its member states. We emphasize the critical importance of addressing antimicrobial resistance and its profound impact on global health. AMR is undeniably one of the most pressing challenges facing humanity, the far-reaching implications extending across sectors, undermining our ability to combat infections effectively. In the WHO European region, as we can see in the roadmap, the toll of AMR is really distressing, and the economic impact is equally significant. Despite strides made through action plans and various initiatives, challenges still persist, including conveying the urgency of AMR, obtaining reliable data, securing adequate funding, and ensuring sufficient resources for implementation. To steer away from an era of untreatable infections, we must act urgently with solutions that encompass environmental and social determinants, digital transformation, people-centric approaches, and strategic partnerships. Therefore, we commend the development of the roadmap, and we believe it can be a vital tool in implementing high-impact interventions against AMR and a critical step towards a healthier and more resilient future. So many thanks to the WHO team that was part in the development of the roadmap. We highly appreciate it. In Romania, we recognize the gravity of AMR, and we are committed to addressing it as a critical public health challenge. supported by the fact that in the last government meeting last Friday, our first strategy for combating hospital-acquired infections and control and stewardship of AMR was approved, having in mind the One Health approach, and also we have already identified eligible funding sources through national and EU funds. Efforts are underway to inform and educate healthcare professionals and the population regarding appropriate antibiotic prescription and consumption. The development of good practices in diagnosis, surveillance, and intervention is in progress as well, accompanied by policies to ensure qualified personnel that are able to control AMR. While progress has been made, there is still an ongoing need to improve infrastructure, hygiene, and public support for comprehensive control of AMR. In conclusion, we fully support the adoption of the roadmap on antimicrobial resistance for the WHO European region, and we think that only through a common multidisciplinary effort can we hope to mitigate the devastating impact of antimicrobial resistance on the health of present and future generations, and we are ready to be part of this collective effort. Thank you.
Thank you very much, Romania. Now I would like to give the floor to Tajikistan. You have the floor, please.
Уважаемый председатель сессии, уважаемые коллеги, Таджикистан поддерживает данного проекта и хотел бы заявить, что республика укрепила свое партнерство посредством разработки второго раунда моносекторального национального плана действий по борьбе с устойчивостью к протомикробным препаратам с помощью подхода «Единый здорово» 23-30 годы. Для подготовки этого плана была создана межсекторальная и межведомственная рабочая группа, координируемая службой государственного надзора здравоохранения и социальной защиты населения Министерства здравоохранения и социальной защиты населения Республики Таджикистан. С технической помощью непосредственно ВОЗа были проведены несколько семинаров, консультативных встреч и работ по выделению серии приоритетных направлений и необходимых мероприятий в стране по сдерживанию и контролю за ППП и ростом УПП. Разработаны рекомендации для специалистов здравоохранения на основе проведенного в стране анализа потребления протомикробных препаратов в период до 2020 года. Созданы системы дозорного надзора, ориентированные на 9 патогенов и их особенностей УПП. Дальнейшее наращивание потенциала обеспечения обучения и лабораторных материалов для отдельных бактериологических лабораторий по идентификации 9 приоритетных патогенов ЦЕЗАР и предварительному проведению тестов на чувствительность к протомикробным препаратам АСТ для мониторинга резистентности и будущего расширения обучения по международным стандартам. Увеличение количества лабораторий, охватывающих внешние гарантии качества по выявлению 6 патогенов их чувствительности или устойчивости к протомикробным препаратам со стороны Центра сотрудничества ВОЗ, Великобритания, НКВАС. Разработана и одобрена заявка в целевой фонд кодекса для поддержки адаптации приоритетных стандартов безопасности пищевых продуктов на основе рекомендаций кодекса Alimentarius, реализация которой начинается с 2023 года до 2025 года. Начата подготовка к адаптации категоризация EUA, классификация антибиотиков к национальным руководствам по регулированию обоснованного использования протомикробных препаратов в секторе здравоохранения. Работа над внедрением трехцикловых протоколов ВОЗ по созданию интегрированной системы надзора за устойчивыми штаммами кишечной палочки в организме человека, домашних птиц и канализационных систем. Таджикистан целиком и полностью поддерживает реализацию данного дорожной карты и готов к рациональному сотрудничеству со всеми подразделениями Европейского регионального бюро и ВОЗа. Благодарю за внимание.
Thank you very much, Tajikistan. As I don't see any other member states who's willing to take the floor, I would like to now give the floor to our international partners. Please raise your nameplate if you wish to speak. No, I don't see any nameplates raised. That's why we are asking, and we are switching actually to the non-state actors, and the Secretariat received one request for a joint statement delivered by Milka Sokolovic, from European Public Health Alliance on behalf of the EPHA, Eurocam, Euronet, HealthNet, EFA, EFNA, EFNMA, EMCA, EPF, and the WFSA.
Thank you.
So you have the floor, please.
Thank you, Executive Director. The European Public Health Alliance, on behalf of its members and other civil society organizations, welcomes the roadmap for action on antimicrobial resistance and fully embraces its vision of people and animals safer from resistant infections by 2030. As a complex health challenge, AMR requires the engagement and coordination of all stakeholders committed to improving human and animal health through ambitious policymaking. The participation of civil society is indispensable to achieve progress on the main pillars of the roadmap. The signatories of this joint statement commit to the implementation of this roadmap by contributing to 4 key areas: raising awareness, improving antimicrobial stewardship, advocating for AMR prioritization on the global agenda, and promoting transparent evidence-based policymaking. We call upon the WHO European region member states to promote the prudent use of antibiotics in all sectors. We call upon governments, international organizations, and the private sector to keep the One Health approach to AMR a priority on their agendas. The health of humans, animals, and the environment are interlinked, and addressing AMR requires collective action that encompasses all 3 dimensions. Policymakers and citizens must cooperate to ensure accountability, transparency, and equity in the design, implementation, and evaluation of such policies. AMR knows no borders. It affects us all, and only by working together we can ensure that our collective efforts are effective, sustainable, and inclusive. In doing so, health equity must be our guiding principle. We must leave no one behind. Thank you.
Thank you very much, Dr. Milka. And the Secretariat received one written statement from the World Federation of Acupuncture Maximization Societies. And it will be distributed through the WHO webpage as well. So I don't see any other speakers who is willing to take the floor at this moment. That's why let me give the floor to Mr. Rob Butler to provide any responses.
Thank you very much. Thank you very much, Executive President, and thanks very much for those 30 member state interventions and the joint NSA intervention that was just made by Milka. We will not get there without all of you, the member states and the NSAs and the partners, absolutely critical, stood alongside us. Overwhelming support is what I heard, and I can't really single you out in terms of responding to the individual statements that were made, but I think maybe just 2 or 3 themes that emerged. Raising the ambition is something that you clearly want us to do, and is something that I hope you understood from my initial presentation was a call from us as well. So we do appreciate that we have an opportunity, and as Aysen raised, the opportunity as we bring the implementation guide and the monitoring evaluation plan to RC74 next year, we have an opportunity to engage in dialogues that will raise that ambition and review the targets that we've set and possibly revise them as we look towards setting a more ambitious goal. So I'm very grateful for that. I also noted the request for stronger tools for evidence-based and cost-effective policy measures. Many of these captured in the roadmap itself, but please understand, of course, they are continuously being developed. We will continue sharing them with you as they are developed. And I think you appreciate that many of the interventions that are in the roadmap are more of the tried, tested, traditional practices of basic IPC in healthcare settings, washing hands, etc., but also introducing some more innovative approaches, as I said earlier, tried and tested and cost effective. So we hope that this is a start to responding to that need for better operationalization. But of course, we have an opportunity again at the regional committee as we put over the implementation guide in the next regional committee. Of course, the networks you also pulled out were very important to exchange knowledge. We appreciate that. Here we will continue creating platforms, as I've said, to exchange best practice, but also really strengthen the network of AMR national focal points, and of course expand our well-established, but possibly underutilized collaborating center network, which was also being brought up. If you'll allow me, I am going to, and it's very nice that Danilo Lofo-Wong here on my right and Miliana have relinquished their 2 minutes of response, but instead I'm going to pass the floor to our chief scientist, and given his strong track record and expertise in this area, may I give the floor to WHO's chief scientist, Professor Jeremy Farrar, to say a few words. Thank you, Jeremy.
Good afternoon, everybody. Thanks very much, Rob, for those generous comments. And I hope I'm not taking somebody else's place in what they were going to say. And thank you to our hosts here. It's been a remarkable couple of days, my first visit to the country, and yesterday's amazing performance. And congratulations on National Day. Just also like to pick out Ireland, and congratulations on winning the AMR quiz. Obviously a huge issue. It's not worth repeating what has all gone said, because as Rob said, the strength of support for this program is palpable. And certainly from a WHO headquarters perspective, that is very, very welcome, and very strongly congratulate the Euro region for the leadership you've given on this. From a WHO headquarters perspective, a couple of things to add. This matters to every region. And just as a personal anecdote, I this week had a phone call from a family friend in another region, admitted to hospital with routine surgery, who will die in hospital as a result of a drug-resistant infection. That drug-resistant infection will not be on his death certificate. There's a huge amount of drug-resistant infection leading to longer stays in hospital, increased costs, and tragically loss of lives than any of us actually appreciate. And that is what we've got to deal with. The whole of modern medicine depends on our ability to prevent and/or treat infections. If we cannot do that, cancer therapy becomes impossible, diabetic care becomes impossible, safe childbirth becomes very difficult, and just about every other part of medicine. That's what's at stake here. In the roadmap, I think just about everything is mentioned. There's one thing that our colleague from Belgium pulled out, which I would perhaps just like to focus for 30 seconds on. We have what we've got today, and we must look after that with infection control, a tripartite approach across animal, human, agricultural, and environmental sectors. And we must make sure we look after the antibiotics, antivirals, antifungal drugs we've got. But if we don't produce new ones in the future, then we will be holding the tide back, but they will inevitably become resistant too. And this is a broken market. Industry has given up in this space, and I'm afraid this will take public sector investment, as it did to have COVID vaccines. We got COVID vaccines in 1 year, which transformed the pandemic. That was as a result of 20 years of investment of public money in basic science that led to our COVID vaccines. We are going to have to take a similar approach to what is a broken commercial market. And unless we invest public funds in that, we will do the infection control, we will prevent the infections to some degree, but in generations to come, we will lose this incredibly important part of the whole of modern medicine. That's our challenge. We will work very closely and applaud the leadership, as I've said, at the European region in AMR, but this is something for the world that we need to bring together. And certainly WHO in Geneva will do all we can to bring us together and be part of this network. Thank you very much, Rob, for your leadership in this, and to the Regional Director, Hans, for the invitation for coming. Much appreciated. Thank you.
Chair, if I may just rapidly, in closing, before I hand over to the Regional Director, just thank the team on AMR, Danilo, Lofo, Wong, but also Ketty, Tina, Jody, Marcelo, and Karen for their support and hard work. With that, Chair, I hand back to you. Thank you.
Thank you very much, Rob and Dr. Freier. And now I would like to invite our distinguished Regional Director, Dr. Hans Kluge, to make his remarks. Please, the floor is yours.
Thank you, Professor Ranov. I would like to express my sincere appreciation to all of you for the very strong support of the roadmap within, indeed, the One Health concept. Remembering that no one is safe from AMR and too many people are dying from previously treated infection, as Professor Jeremy Farrar just was reminding us, that the cost to health system and economy is staggering, and that high impact and often cost-effective interventions are available. I would like to encourage all of us together to actively engage in the preparations for the upcoming high-level meeting at the United Nations General Assembly in 2024, particularly as one of the two leaders are in our region with Malta. And thank you very much to Deputy Prime Minister Dr. Fern for marshalling the way to the UN high-level meeting in 2024. Finally, thank you very much to you, Rob, to Danilo, and the whole team. Thank you.
Yeah. Thank you very much, dear Regional Director, Dr. Hans. And to conclude this agenda item, we are now ready to consider the adoption on the proposed draft decision contained in the document on the roadmap on antimicrobial resistance for the WHO European region for 2023-2030. Is the committee willing to adopt the proposed draft decision by consensus? And I see no objection, and thank you very much for your interventions, and the decisions therefore adopted.